All right, well, welcome to Tuesday Night with County Executive Pittman, and I am County Executive Steuart Pittman. And our topic tonight is COVID vaccine strategy. And I've got with me our Fire Chief Tricia Wolford, our Health Officer, Dr. Nilesh Kalyana-Raman, our Director of Department of Aging and Disabilities, Carissa Gowan, and our Deputy Health Officer, Tony Gedden, who is the person who does the logistics at our vaccination site. So for the health department. So this is not a new topic. We've been talking about this pretty much all the time for the last couple of months. And it's a frustrating topic, but I did want to do this and give people an opportunity first to hear from some of the folks who have developed the strategy in the county and are implementing it. But then to hear from you with ideas about how we can improve, questions about why things are the way they are. I can just tell you up front that it's been a frustrating process, that the health department had been working on this for months, really knowing that there was going to be a vaccine, and all kinds of capacity has been developed at sites that we haven't even opened because the problem that we all know is there aren't enough vaccines to go around. So the question in everybody's mind is, well, who comes first and how are they selected, and why is it why are there so many locations and so many sites and so much vaccine surfing? And those are some of the things that we're going to address tonight. It's not the way we would choose to have it, but in Arundel County, I think our departments are working hard, working together, doing as well as we can do under the circumstances with the limited supply that we have. But we can always do better, and that's why we're here to listen to you. So I'm going to first ask Dr. Kalyana-Raman to give us a little bit of a overview, big picture, where we are and how we got here, and then we'll go from there to his deputy, Tony Gedden. So Dr. K.
Thank you, County Executive. So big picture, how do we get here? Well, we're actually coming up on 1 year since the virus first arrived in our county, in our state. And I'm not going to recount what that journey looked like. You all are aware of that. But I think what is important to note is that it is amazing to have seen a vaccine come out 1 year after the discovery of this virus. One of the things that we saw last year was that people were really pulling together and working as neighbors, families, communities to pull through this. And I think the vaccine is challenging because there's limited supplies, and it kind of tends to push us in this direction of, well, I got to get my vaccine. And that's very understandable. But I think now is the time, really more than ever, to make sure that we continue to have that sense of unity, of purpose, because there isn't enough vaccine supply, right? While the vaccine was approved in December, or actually 2 vaccines were just approved in December, that's not the same thing as manufacturing enough doses, not just for people in our county or state or country, but also around the world. And then the second is we have to get it into people's arms, right? A vaccine sitting on a shelf doesn't do anything. A vaccine in your arm does. And so what we're seeing is, in terms of prioritizations and who's in which phase, is really a way to try to get vaccines into those who are A, at greatest risk, and B, whose jobs are considered the most critical, and also face the highest risk in terms of exposure to COVID. And these determinations were made at the federal level, at the CDC. And our state is largely following that, and we as a county are following what the state does. That's why you see in the first few phases, people over 75 are being prioritized, first responders and hospital workers, people who have to go to work every day, face uncertain situations, and are exposed to a wide range of people are being prioritized because they never know what they're going to run into. But as we do this, we're confronted with a couple of different things: speed and equity. The faster we get these vaccines into people's arms, the faster that system is really geared towards people who can click through on websites, surf multiple websites to get appointments. And for those who are don't have the time to do it, don't have the wherewithal to do it, maybe don't have internet access, it's harder, right? And that's where the equity piece comes in. We've got to balance both of those things. Now, we as a county health department, we can push these vaccines out. County executive mentioned that we have limited supply. We get now for the first time, actually on Friday was the first time we found out for more than just the coming week how many vaccines we would get. And we're going to get 3,400 doses, first doses each week for the next 4 weeks. That's not enough. We know that. And that's why we're staying in our phase 1B, is because we still have tens of thousands of people in that category, 75+-year-olds, educators, childcare workers, and now people with intellectual and developmental disabilities who are added to 1B. But at the same time, we want to make sure that we're reaching our Black residents who have been hit hardest by this, our Hispanic residents who've had disproportionate rates of disease from this, our rural residents who don't have as much access to the vaccine, to make sure that we're getting everybody equitably as part of this process. And that's why we're going to be opening up community sites beyond the sites that we have right now, and continue to focus on both speed and equity as part of our process. And so with that, I'm going to turn it over to Tony to talk a little bit more about what the process looks like. Tony, over to you.
Thank you, Nilesh. So really, how do you get a vaccine, right? What do you go about doing if you want to access a vaccine through the health department? It starts with our pre-registration website. So you can find this website on the county's webpage, on the health department's webpage, and you go on and give us general information about yourself, your name, your date of birth, your occupation, and we'll let you know which phase do you fall in, right? Some folks have questions. Am I 1A, 1B, 1C, 2? Where do I fall? So it will tell you which phase you're considered. It'll also give you our estimate for when we will start to vaccinate that phase. And that also puts you in the mix of people that we can send invitations to for a clinic when you are eligible for a vaccine. So what happens now, once you've completed that process, you'll get an email thanking you for pre-registering, giving you a little information about the process. You can also opt in, and I recommend that you do, to the weekly emails that will come out of the county executive's office to give you updates on where we are, what's happening. You opt into that and you can kind of stay abreast of where we are, what's happening. So what do you do with the pre-registration, right? Where does my information go? What does this mean? It means that when your group is eligible, we will be selecting people from the list randomly, and then you can be selected. And what will happen after that, you've given us your email and how to contact you. If you don't have an email, you can put no email and we will give you a call if your name is selected. And from there, you get sent a list of links to clinics. So in that email, you can sign up for the day, the time, or the location that works for you. So right now we are operating 3 locations throughout the week. Next week, we will be adding locations in South County and West County, but right now we are operating in Glen Burnie at Bay Meadow. That's a drive-through. So if you have any sort of issues with ambulating or walking into a site, standing, you don't have people standing very long, but if that is a concern for you, please do consider our drive-through as an excellent option. We're also have a clinic inside Arundel County Community College and their student union. They've been a fantastic partner to us, and we're able to really vaccinate a good number of people there. It's a large site. And we're also in Maryland Live Casino. So those are the 3 locations that you can find us multiple days of the week. The casino and the community college, we're there 5 days a week, and weekends also at the community college. For the drive-through, we're operating that typically 2 to 3 days a week, depending on the demand. We've found that people prefer to go indoors, but we want to make sure we offer a drive-through option for those that mobility might be an issue for. In addition to that, we've started vaccinating in senior housing facilities. So really trying to target our older adults who have been really vulnerable and are living in congregate settings. So that's how you can get a vaccine. So what do you need to bring to the vaccine site? So right now, if you qualify because of your age, so if you are 75 or older, any sort of documentation that says this is your date of birth and this is who you are, we will accept. If you are coming because you qualify because of your occupation, so if we are still vaccinating some members of 1A, which would be healthcare workers, first responders, your work ID, a letter from your job saying this is where you work, we'll accept all of those things. So that's how the process happens. After that, how do I get my second dose? That's the other really big question. We're trying to schedule as many of those on site, real time before you leave as we can, especially for those who have barriers to technology, as Nilesh mentioned. So we try to target people who tell us that they may struggle to, they don't have an email or their internet access is limited. We try to work with those individuals. But after your appointment, you will get a link inviting you to your second dose appointment. Those links usually go out 2 to 3 days after your appointment, and you're able to sign up, depending on the vaccine that you were given. Within 21, 28 days after, you'll get an invitation to the second clinic. So that's how the process works. The other big question we get is, can I pick the vaccine? At this point, we are one of the health departments that has both vaccines. So it really depends on the day that you come and what we've been given by the state. And I would personally highly recommend that whichever vaccine is available, they are really equivalent at this point. Both the Moderna and the Pfizer are very similar in their effectiveness. Please come and take either one. So that's the how-to at this point. That process is evolving and ever changing. And as it evolves, we will make sure we keep folks posted.
All right. So we'll get back into some of that as people, I'm sure, will have questions about all of this. But we're going to jump next to our Fire Chief, Tricia Wolford, who most counties' fire departments are not involved in vaccination, but in Arundel, they absolutely are. And tell us how, where, why, and whom.
Thank you. Good evening, everyone. So yes, we're absolutely honored to be a part of vaccination. And I think it's been a great partnership to work with county agencies, especially the health department. Everybody's working 120% all the time. So we're happy to be a part of that effort. We started with vaccinating public safety. We did that at our fire training academy, and we vaccinated any public safety official in the county that wanted to be vaccinated. It was a wide range of first responders, EMS providers, firefighters, law enforcement. And that was really a great effort. Everybody has been now through their second dose. So we did that second clinic. That was over 2,000 first responders that we did. And then with the help of the county executive and Dr. K, we thought, what other way can we make an impact while Tony and the health department are working on 75 and older and making an impact in that group as we move through the tiers, than to work with the Anne Arundel County Public Schools. And that partnership has been phenomenal. Vicki Plitt has been a leader for her team and coordinating with Chief Lisa Mayers and having those clinics function on a weekly basis. So we're in our second week this week. We'll vaccinate tomorrow, and we'll have over 2,000 to vaccinate tomorrow and work on just getting through the process like everybody else. It was seamless last week when we did it. We're at Severna Park High School. I know all those appointments were rapidly filled, and there's always a standby waiting list. So it's really just been a great impact for us as EMS providers who are used to working as clinicians in the field and dealing with emergent medicine, to actually do this type of medicine and have this positive impact on the community has been fantastic. I was telling a couple of folks who had seen the clinic for the first time that the feel in the room has been great, and the staff has been phenomenal, and the teachers are excited. So it's great to have educators in there and looking forward to that. So honestly, we're just happy to be a part of the solution, and the more we can do for the community and the more vaccines we can get out, we are here and until the end. So we're happy to do it.
Great. And I just want to add, as a bystander, really, who's been to to your clinic last week with the teachers, Chief Wilford, as well as to both Anne Arundel Community College and Live Casino run by the health department, that the lines are not long. The systems are set up so that people are socially distanced. Everybody is really professional, and we get so many compliments from people. The people who are getting vaccinated, of course, are very happy. The ones who are not as happy, but we're hearing from the folks getting vaccinated. And I just want to thank all of you for the incredible logistics that you do in moving this forward and getting it done. And I do want to note that for non-public school teachers, whether they're from private schools, childcare as well, or higher education, that we do have clinics for them. I think that was not quite described accurately in the paper recently, that they come through aacounty.org/COVIDvax, and we have had some days early on they were mixed in with the seniors, but there are separate times at those two sites where educators are being vaccinated as well. And we've organized it by ratio of population, so it's about 2 to 1. Public school, private school, and others in that category, and we're keeping up with those ratios. So both sides are saying the other is getting done faster than they are, and that's understandable. But we think that we're being equitable on that. So, and finally, we want to hear from Carissa Gowan, who's Director of Aging and Disabilities, because we first of all know that particularly folks over 75, but also over 65, the next group in 1C, are particularly vulnerable. And when they do get COVID, they're much more likely to end up in bad shape in the hospital and even to die from it. So more often than other groups. So the vulnerability has been important. But also, we've got this weird system where it seems like if you're really good at surfing for vaccination sites on the internet, you're more likely to get vaccinated. So it's really been important for older people who are less good at surfing the internet, not all, but most, to have aging there doing the real hand-holding and the phone calls and the extra work that you do. So tell us about your role, Carissa.
Thank you. So the mission of my department is to serve older adults, individuals, and caregivers in the community, as the county executive has said. So given the initial phases of this vaccination, we've worked very closely with the Department of Health on a variety of initiatives to support older adult population in our community. So our departments worked very closely with local and state departments of health to identify and track vaccination clinics for nursing homes and assisted livings, of which in Anne Arundel County, we have 139. We've also worked very closely with the Department of Health to identify, establish, and track vaccination clinics, as Tony had said, for our congregate and senior independent housing facilities. But I want to say one of our greatest efforts in providing support to older adults having barriers to technology is the support that they receive through the COVID Care Warm Line. This warm line, it's evolved throughout COVID. It was first the food access line, the COVID care line, and now we're looking at assisting our older adult populations that are having extreme barriers to technology. So this has been a tremendous team lift from all of county government. Numerous dedicated employees from all county agencies and departments have supported this warm line in partnership with the Department of Health. Some of the agencies and departments we are truly grateful for that have provided staff to support this line include the Community Engagement and Constituent Services under the County Executive's Office, the Anne Arundel County Public Libraries, Office of Emergency Management, Central Services, Department of Recs and Parks, Department of Public Works, and our Office of Information and Technology. So really, you know, every facet of government has worked to support this line. As of right now, since we started vaccinating category 1B and 75 plus, in the past, I want to say 4 to 5 weeks, we've handled on that line over 7,000 calls and helped 7,000 older adults. The line that I'm mentioning can be accessed for technology assistance by calling 410-222-3663. So we've worked diligently over the past few weeks with this warm line to streamline the process, providing technical assistance to 75 plus in both pre-registering and registering for the vaccination. Additionally, through this warm line, many county departments and agencies have assisted with last minute, weekend and holiday registration for rescheduled vaccination clinics. The weather, in the past month has not been kind to us. But I'd like to really also take this time to share a story that's really testament to the experiences of older adults in our community. And it's shared by a great many callers that we come into contact with on that line on a daily basis. So we had, a wife call into the warm line. She was 82. Her husband was 87. Both of them having chronic conditions, limited mobility, and limited access to their community. Both of them did not have any access to the internet. They did not utilize a home computer, and they had no established email. So what is that couple supposed to do, given the fact that the established means of registration and even pre-registration is all internet-based? They tried calling, like many older adults in the community. Instead of surfing, they're making phone calls to a variety of business locations that are becoming known to them through the television. And they're waiting for hours on end. Either they can't get through, and of course they can't, go online to fill out a form. So they did end up calling the COVID Care Warm Line, and they were greeted by one of our county department staff. And you could just hear the audible sigh of relief in their voice that, after this time of severe social isolation for almost a year, and the feeling of hopelessness and not knowing how they're going to get and register themselves for a vaccination, that we were able to walk through this process with them. They were, as many of the older adults that we talked to and call back, they were so very excited, so very grateful. They've been isolated from their 5 children and 14 grandchildren, living in Florida, not knowing, when they're going to be able to visit those family members. So we walked them through the process. Their next concern and fear, as they see on the television, that you see long lines, you see cars backed up for miles. And they were concerned, as most older adults are that are watching this happen on national news, that they would too fall to this process. But they called back after they had their first vaccination and couldn't be more happy. They were able to walk in. There were no long lines. They were greeted with compassionate staff from the Department of Health, and couldn't be more grateful. So this is one story of many individuals sharing the same challenges as others in the community with technology needs. And knowing that these are the barriers, we produced a step-by-step video for individuals in the community with resources to show them how to pre-register. That is actually on our website as well as our social media platforms. It's part of our ROVERS program, which stands for Remote Online Virtual Education, Educational Resources for Seniors. And we've created that video to walk older adults through the process in a very uniform, slow, simple manner. The video highlights and explains the pre-registration process. And given its popularity, we're now working on a second video to highlight how the vaccination registration email works, and to walk older adults and individuals through that. We continue to adapt our level of services and supports based on what we're hearing every day. And I know that's true for all of county government. We're listening to our community and adapting and changing and evolving with a very fluid process. So thank you, everyone. And back to you, Mr. County Executive.
Thank you, Carissa. I want to jump right into the questions because we have 4 pages of questions and each one has got at least 10 on them. So I don't think we'll get to all of them, but I want to get some out there really quickly, starting with Sandra, who says, I have signed up for multiple sites, but have had no luck. Is there any way to find out where vaccines are available and how many? And I want to take the first crack at that and ask Jenny if she's there to put up the weekly report that we've started to put out. And you can get this off of our aacounty.org website. It's being sent out by constituent services. And if you just scroll down, you can see it gives the current metrics and how we're doing. Luckily, case numbers are going down, which is a good thing. A few words from me with some links. Where we're at in that pyramid is the phases that were established by the state of Maryland. We have 1A and 1B in color. The next one is going to show in a lighter red 1C. The pharmacies are in 1C. We're still focusing on 1B because, as the health officer said, we have so many people still in that group. And then you scroll down further and you see at the bottom of the page how many doses each week. We put this out after we get our state allocations, so you know how many doses each site has. Unfortunately, we know how many we're getting, the health department. We know how many our hospitals are getting, but they don't yet publish. And we've asked the state to start publishing, and we believe eventually they will, how many of these pharmacies in our county are getting and how many are at the state mass vaccination sites. So you know where to bother doing your vaccination surfing. Don't bother places that have only 100 doses. You're not likely to get an appointment. Scroll down a little bit further and you can see that we've got in that box on the left, unfortunately, all of the places that you can go, which was the question, and links to all of them and any information that we have about them. This is the unfortunate place that we're in where you have to surf. But the good news is that Anne Arundel County Health Department has more doses than other locations, and we want to keep it that way because they're doing such a great job. So aacounty.org/COVID-vax is, let's go back to the main screen, is the best location. You can also go to the state site though as well, and they list locations. Most locations, certainly the state vaccination sites and the pharmacies, don't care what county you live in. So plenty of people have gotten vaccinations in other counties, and people have gotten vaccinations in our county as well. Health departments tend to want to vaccinate their own folks, as do we. So anything to add on that? Anybody? That question of where do you find out where to go? Yeah. I mean, we have requested from the state, all the counties have requested of the state that either we be allowed to do our own single site to feed people to all the other sites from the pre-registration, or to have the state do that. So far, we've not been given that authorization to be able to work it that way. Okay, once pre-registered, this is from Janet. How are people selected to schedule vaccine appointments? I'm a 77-year-old woman with several high-risk factors and have been unable to schedule an appointment. And I don't know if that's you, Tony, or you, Dr. K. How do we pick them from that long list of, I believe, is about 116,000 at this point?
Yeah, so thank you for the question. Based on the number of vaccines that we have available, and again, we're spreading, as we mentioned, we have 3,400 vaccines spread across a number of different groups. Our 75 and up population is one of the groups. So in that mix, we have to then go into the pre-registration system. And again, we have the computer pulls a random list for us of those over 75 that are in the system. So then you would get an email to invite you to sign up for a clinic. Unfortunately, because we don't have more vaccine at this point, we don't send the invitation to everyone in the system at that time, right? So if we've got 25,000 people, 75 and up in the system, but we know that we only have a certain amount of vaccine that week allocated to that group, then we try not to over-invite too much, because then you have a lot of people kind of scrambling for a certain number of appointments. So we try to keep it to a reasonable number, but that means that every week you may have signed up and you might not get an invitation this week, and you might be waiting for a little while until you actually get an invitation. I had someone ask me today, do you have a time frame for that? Unfortunately, we don't. We can't tell you exactly when your name will be picked, but that is how it works. And just know that if you have pre-registered and got that confirmation, you are in the system, and we are working our way through those lists of individuals as quickly as we can, and really trying to make sure in coordination, in particular with Carissa's team, to make sure that we are doing as much outreach and calls and targeted efforts to get our seniors vaccinated. So I would say I understand that it's frustrating, and we're trying, and we are trying to vaccinate as many seniors as we can.
Your kids are there, aren't they?
They're-
They can come say hi. It's the times we're in.
They ran away.
They ran away. Yeah, and I would just add, if it hasn't been noted, that when you do get vaccinated, whether you get vaccinated through the health department or any other site, please take the time to go into any sites that you've registered at and take your name off, particularly our site, because that way we know that you've been vaccinated, and we will not be wasting time contacting you about another appointment. So here's another question from Calvernet. I am a high-risk African-American resident. My understanding is that African-American residents are not signing up for the vaccine, but I know many, including myself, who have pre-registered and are still waiting to schedule an appointment. Why haven't we been contacted yet? I guess I don't know if it's a direct answer on that question or the general statement that African-Americans are not signing up in as high numbers and what we're doing about it.
Tony, you got this one, or?
Go for
Oh,
it.
well, I was gonna, yeah, why don't you start with it? I mean, there's a lot to say here. We have
Yeah.
a whole plan
So-
and a whole committee working on this. Yeah.
Yeah, so this is definitely an issue that we are working through. One of the things that we found is that African Americans and Hispanics are actually pre-registered at lower levels than we would expect. So we're making sure that appointment invites are going out in a way that we're not underrepresenting any minorities. So making sure it's at least consistent with our demographics as a county. Our invites are going out. This is particularly important because African Americans have been hit harder by this pandemic with death rates and infection rates about 1.5 times higher than you would expect. Hispanics with infection rates about 3 to 4 times higher than we would expect based on population. And we're also engaging with community organizations to do pre-registration drives and are working through what that looks like as well. And Tony mentioned some of our community sites that'll be coming up in the next week or so. So there's a lot of work being done around this, but know that we've got your name. I'm sorry we haven't gotten to you yet. There's just tens of thousands of people, and as we work through it, it means that only a slice of folks get an invite each week. And we're hoping as supply increases, we'll be able to get to people faster and faster.
Okay. And that the system is software that actually selects, right? So that it's not anybody picking and choosing, but it's programmed so that it will reflect the demographics of the county with the final result, which is a good thing. I'm not sure that the state or any other of the pre-registration sites do that. Okay, here's a couple. Have you closed the loophole where multiple people can use a private appointment link from the county? Joan, somebody's been doing that, I understand. More than one.
Yeah, so unfortunately, no, Joan, we have not closed that loophole. And what happens is that we share a link with the individual that's pre-registered and that we intend to invite to the clinic because they're now eligible. And then because people want to make sure that their families are protected or others that they know, they share the links. The issue with this is that if you're not an eligible individual, either through your occupational category or your age at that point, we then have to we are in the process of kind of scrubbing list to see who's in there, because we want to make sure we're getting to the eligible folks. So when you have folks who say haven't been invited yet, they're not able, and the clinics will fill up. So there's a maximum capacity when you go to sign up. And if it really won't let you exceed that capacity too greatly. So then we want to make sure that the folks that we're targeting are actually able to get in. So we will send emails saying that, your appointment has been canceled. But we really, really, really encourage folks, please don't share the links with folks that aren't eligible for the vaccine. It definitely slows down the process, keeps people who are eligible at that moment from being able to access the system, and just creates, kind of a backlog that we work through, but we'd love to be focusing on calling people back to try to get them registered, as opposed to saying, we're sorry, right now you're not eligible. So we know it's frustrating, and we know people are trying to access this very limited and important resource, but the link sharing definitely creates issues for us on our side, especially when you share links to second dose clinics. Those are kind of a one-for-one. Someone's name is kind of already attached to that second dose because they received their first dose. So those sorts of things are common. I know that we use the state system called PrepMod for the actual vaccine clinic registration. And I know that they're working on some things to try to improve that. But right now, they are shared. We've seen them posted on social media. Please don't do that either. But we're working through that, and we have not fixed that loophole. There's a lot of hours of work on the back end to try to clean it up as we go.
Right, and we're I guess depending on the state to fix PrepMod so that there's a system so you can identify who the person is who's supposed to be using that slot. Okay, there are a number of questions that are the same question, which is basically, I'll use Janet's version of this. Why is Anne Arundel County still in 1B when the rest of the state is in 1C? And I'll make the first comment on that, which is that while the state of Maryland says that 1C, which is, we're talking now 65 and above rather than 75 and above, and frontline workers as well as teachers and educators, the state is still telling us that we should be prioritizing first doing the people in 1B before we do 1C. And so we're complying with the state on that by prioritizing them. But the reality is that it's true that at the state mass vaccination sites, they're taking people in 1C, and the pharmacies are taking people in 1C. So it's possible to get vaccinated if you're in 1C. It's just that we're not going to select you in the health department's COVID vax site until we get through most of our 1Bs. And same was true with 1As. We still got some 1As that we're working on. So anything to add on that, anybody?
Yeah, just one thing. This is where that equity piece comes in, and making sure that we're reaching those who are harder to reach and in need of vaccine. And if we have to have systems that balance both of those, and the state has the speed part, and we're going to focus more on the equity part as part of that. Doesn't mean we're going to go slowly, but it does mean that we put a greater emphasis on equity.
Okay, and then we've got some folks asking about a new group that was added to Priority 1B and what the county's doing about that. So why doesn't the county allow individuals with intellectual and development disabilities to get vaccinated in Priority Group 1B? And I believe the state just added that group. Correct me if I'm wrong, or add anything to that and how we're going to handle that.
Yeah, the state just added that group about a week and a half ago. We've been having conversations with the ARC, and we're going to meet with them this week to kind of put the finishing touches on how we want to do this. This is the first group that's eligible based on a health condition, so it is different from our age or occupational groups, and we want to make sure we do this right, so that we can get those with the disabilities properly vaccinated. So it is coming, and we'll have that ready to go either end of this week or beginning of next week.
And so I'm assuming, this is me asking the question now, we're going to have that in our drop-down menu. When you select the group that you're in, that will be added soon to that list.
Correct.
Okay, so stay tuned. We'll make an announcement when that's up there. Okay. Okay, there are a number of people. Similar question here. How will residents with comorbidities be placed in the priority queue for vaccination, Glenn? With conditions that have been identified, I guess, by the state. This was another group that was added recently, right? For people who have certain health conditions.
Yeah, for people who have certain health conditions who are currently hospitalized, the hospitals will be doing that, or and for a very limited set of conditions, who are receiving their treatment in hospitals as an outpatient, so cancer patients, those go through the hospitals. For the large number of people with chronic health conditions, those folks would be in phase 2.
Okay. And I just got to throw this in there. This is one of the questions that I know there's not an answer to, at least not an accurate one. When will vaccines be available for the general public? Last on the priority, from Karen.
That's a good question. Fortunately, we just don't have a great sense of what the volume is going to look like over the next few months. We'll have to stay tuned on that one.
It really has more to do with supply, which is federal. They're trying to get a handle on that. Johnson & Johnson single dose vaccine might be approved soon. Any thoughts on that, Dr. K?
Yeah, the approval is coming up for review at the end of next week. Really exciting. Data looks good so far that they've released, and we'll see the full set of data. But that'll certainly, if that gets approved, that'll help with vaccine supplies, and it's a one dose shot. So it allows us to move a little bit more quickly through people to get them fully vaccinated. So we'll over the next few months, we'll see additional vaccines coming up for approval, and we'll see increased vaccination supply as well for manufacturing. So it'll get better. It's just hard to give you a timeline, but it will get better.
Yeah, I hear there's millions of doses that are being manufactured right in Baltimore City. I hope they have good security. Yeah. Okay, we could use a few of those. Here's a good question from Cara. What explains the differences in vaccination rates by county? Is it because vaccines aren't being distributed proportionally to the county populations, or are we not distributing our vaccines as quickly as other counties? I'll let you all just talk about how quickly we get them distributed, but I want to say something about the proportional numbers of vaccines county by county, because some had noted that it looked like central Maryland counties were getting fewer per capita than the more rural counties and outlying counties and the rest of the state. And people were noting that they were moving into 1C really quickly because they say they'd gotten through 1A and 1B. And that does seem to have been the case. And this is why it's so important that we get not just the state to report on the numbers of vaccines to health departments, but the number of vaccines to hospitals and pharmacies and other methods. So there is that perception out there that the central Maryland counties are getting fewer per capita, and there's variation within that, we believe, but that's why we've been so insistent that we get that data and they be transparent about it. But the other data that they sometimes talk about, you'll sometimes hear this in the governor's press conferences, is that some counties are moving more slowly at getting each week's allocations out. And if you don't move quickly, you don't get as many allocations in future weeks. Are we getting them out fast enough? How's that going? Either one of you from the health department.
Yeah, so we have the capacity to get every vaccine that we're given on a weekly basis out within the next 7 days of delivery. So the delivery week doesn't fall cleanly on a Monday. So sometimes, depending on when you look at the data, it looks a little different, but we do have the capacity to get all of the vaccines out. I will say in the last 2 weeks, because of the cancellations or delays with weather, some people will schedule and then not schedule back. But for the most part, prior to that and this week, we are getting the vaccine out within 7 days of getting it. Obviously, when we get a delivery, it's not going to be out the door the next day. We try to spread it across different dates and times for accessibility for folks who are working. So if you need a weekend slot and we get a delivery on Monday, we try to make sure we have vaccine on Saturday and Sunday. We try to make sure we have vaccines on evenings. So every day of the week, we're trying to make sure that we can vaccinate to really increase accessibility for those who need it. So it isn't an immediate process, but within that week, we try to get all of our vaccine out the door.
So we are getting them all out, and we could handle a whole lot more. I know I've heard you say we could handle at least 4 times what we're getting, if not more than that, and we could scale up beyond that. So, but we do have to spread them out over the week. And when the snow comes and we reschedule, that slows things down, but that doesn't mean that they're not getting into people's arms. Okay. Why are there no large vaccine facilities in Anne Arundel County like the stadium and Six Flags sites? When I try to sign up at these sites, I am told I cannot since I'm not a resident of the county they are in. Tim, that should not be happening. The state sites are supposed to be for residents of any county. Six Flags is really only 6 miles from the border of Anne Arundel County. And we would like to get them to agree to take our people off our list, but they've not agreed to do that yet. We would like to get a mass vaccination site in our county, and we're prepared to do one, but we don't have the vaccines to do it with. So if the state would set one up, we would be very happy about that. But so far, you're right. We don't have one. So if they're telling you that you have to be a resident of the county and it's a state site, please let us know. That shouldn't be happening. It also shouldn't be happening at pharmacies or hospitals for that matter. So, okay.
And one thing, even at our health department, while we give preference to Anne Arundel County residents and workers, we're not closed off to others. It's just that those are the ones who are going to get the first invite. So
I hope nobody outside the county is listening. Okay. Yeah. Well, yes, we care about everybody. And these are, I mean, by federal law, in fact, you're not even allowed to say people from outside your state can't get your vaccines, because the idea is that no matter where you live in the country, you should be able to get vaccinated. And so, yes, people are traveling across state lines to get vaccinated as well. Okay, let's see. I think we've answered a lot of this. Here's a tough one. How can individuals like my father, who is disabled and bedbound, receive the vaccine if they cannot be transported to a vaccine site?
This is something that Nilesh, Carissa, and myself have actually talked about a number of times, and we are trying to create a plan to get out to folks who are homebound to get vaccinated. We're not there yet from a staffing and logistics perspective, because there's an observation period of 15 minutes after the vaccine is delivered. And once it's unthawed, you've only got a certain number of hours, right? So if you're trying to travel between house to house to get it, we just have to make sure that we're not wasting any vaccine in that process, and that we have a really safe process for residents. So we are working through that, and we will have something hopefully in the next few weeks. But it is a question that we are working through, and we know that there are homebound individuals who meet our current criteria to be vaccinated, and we don't have a process for that just yet, but we are working on it.
I know Carissa will make sure that you do not stop working on that until you get it done, because those are her people. And she will be on top of that, and that's a good thing. I think we all agree that that's important. This isn't a question, I guess it's just for me, maybe a comment that for folks who don't have their own transportation to get to a site, a lot of those folks are getting transported by the county, by Anne Arundel County Transportation. And to do that, Carissa, do they call you if people need a ride?
They can either call our Maryland Access Point line, which is the 410-222-4257, or they can call the Office of Transportation line directly and coordinate their transportation.
Okay, and maybe we can get that put into the Facebook chat as well, so people have that. Okay. And then there's some questions about or some suggestions that we send vaccinations to childcare centers, as well as smaller employers like schools, sort of like we do pop-up testing, pop-up vaccination at work sites. Are we thinking about doing that?
Yeah, we are definitely considering more community sites. Right now, we're in our senior housing communities is where we started, just trying to make sure we're hitting the 75 and up population, but we'll be working through how we could be in different places in the community. So we're not quite there, but we are thinking through it, and we'll be looking for partners. I know, depending on where you work, we may not be able to get to everybody. There are a lot of folks who would obviously, that makes it very easy, and eliminates a lot of barriers for folks, but we will try to offer that for our more vulnerable populations and folks who really have a hard time getting to our other vaccine sites. So more to come on that.
Okay. Could there be, this is from Susan, could there be a standby waiting list at vaccination sites so we can be notified in the case of a cancellation anywhere? And I'm sure that you all have plans for what you do with any excess, if there are any excess vaccinations at the end of the day. But let me ask this to Trish Wolford first, because they may do it one way, and then Tony can tell us how the health department does it. What do you do at the end of the day? You have leftovers?
We do not waste a drop, literally a drop. I feel very, very accountable for every drop and every dose. So for public safety and schools, it just depends on who's actually organizing those lists. But we keep a set standby list of anywhere from 15 to 30 people. So I'll just speak from how we did it for public safety. So every day we had a standby list of anywhere from 15 to 30 people, all within 30 minutes of the vaccination site. Obviously, if you're working with Pfizer, there's a little bit more of a crunch time with using that versus Moderna. And then we just let those folks know, our clinic ends at 8 or 9 p.m., whichever it was, whichever day. You could be getting a call anywhere between 8 o'clock and 9:30 that says, come on down. And they were still part of our public safety group. So maybe they were scheduled the next day and we knew we would remove them from that clinic. And then we had a backup plan to a backup plan where we were able to say, okay, we have, one dose left and I'm not going to waste one dose. And in one instance, I drove that dose to a house where it needed to be because they were eligible, they were on the list. They were like, I can't get there. So I take that, I take the card, I take the swab, we do all the things we have to do because you're just committed to making sure that works. I will say the team that is drawing up in regards of Pfizer, the team that is drawing that up has it very well calculated. They're looking at those appointments in 30-minute blocks. And as you get closer to the end of the day, we're seeing, okay, this many, maybe one's going to be a cancellation. You're not real sure. So they're very much taking their time and watching how many people are coming in the door. And we have that system well calculated and that flow down very well. But that team is being very specific about how much they're taking out and how much they're drawing up. So we have not wasted a drop. And I'm guessing Dr. Hay can probably speak to the dose allotments, or Tony can, of, what you get versus what you can draw up sometime. And so we factored that in. It's a very redundant process, but we always have plan A, plan B, and then backup plan for plan B, which is plan C. But that's just a little bit of the fire department in general. So that's our process.
Not only do you have to worry about what happens at the end of the day, make sure that every dose gets in an arm, but what happens when the forecast changes and you thought you were going to be able to do Sunday morning clinic and it looks like the snow and the ice are coming sooner. So what do? You call, what was it, 280 or 300 folks you called, and you got them to come that same day, Saturday, so that you could get all those doses into people's arms. That was just one example of the kind of really heavy duty customer service that you get from county government that you might not get from a pharmacy chain or a bigger or a different kind of an operation. Do you have anything to add, Tony, on your system at the end of the day to make sure that everything gets?
Yeah, so there were two parts to that question, and our process is very similar to Chief Wolford's. We are drawing up as we go. So really saying how many people are left on the list, how many vials do we have? And depending on the vaccine type, you may get more doses out of a Pfizer vial than sometimes you've anticipated, which is a good thing, right? You want to get extra doses out, but just really keeping a very close eye and tab on that so that we are not wasting doses. In our case, oftentimes we may have another clinic happening. So vaccines can be, if there are 2 to 3 left, can be transferred to the next site. We don't have a standby list for most of our open clinics. When we've done some occupational things, we have had standby lists. We will be putting a wait list. I think the first part of her question was, do you have a wait list in case someone is canceled? There is a wait list functionality in PrepMod that we will be enabling this week to make sure that people are able to, there could be hundreds of people on the list, but if someone cancels, we can try to get someone else in there. We've been working really closely with Aging and Carissa and her team oftentimes to make calls the night before, the day of, like, we've got 10 openings. Can we call 10 folks who are 75 plus to make sure that we're not wasting any doses and we're getting our most vulnerable eligible folks in those seats. So the process really depends on the day, but we have not wasted any doses and are committed to not wasting doses.
We worked that list, and I guess it was Saturday, you all, Carissa, got an email from the state asking for 2,000 names of seniors because they were looking for folks to put through the Six Flags site. And by Sunday, they had that 2,000 name list. And we'll be following up and hoping that those folks do get vaccinated at Six Flags, and letting them know that the state may be contacting them. And please take the call. It's not one of the scam calls that we've heard about. Just a couple more. We're almost done here. We're actually gotten to the 4th page because I didn't ask every single question. I didn't do the repeats, but we're almost done. We have some health questions and some second dose questions. So the first one is, I got my first vaccine, but had to drive to downtown Baltimore to get it. This is from Nancy. If the supply increases in 3 weeks, can I get my second shot in Arundel, or do I need to get it where I got my first?
So we are encouraging folks, if they can get back. So we've had people move across country, right, and say, I need a second dose. I got my first one in California and I moved, or I'm a travel nurse and I'm here now. But we do, if you can go back to the site that you received your first dose, we recommend that, because the second doses are shipped to us. Even if supplies increase, the second doses will not. They are 1-to-1 for either 21 days or 28 days prior. So that 3,400 doses that we received yesterday, 4 weeks from now, we will get 3,400 doses again. So it is a 1-to-1, hopefully, of second doses. If the process works as it's supposed to, we will have vaccine. So what that means is that someone else is waiting on their second dose that they received from us. There are instances where it may be possible, but what happens when we do that is, in order to make that happen, we have to take a first dose from someone. So if it's possible, and I realize it's not always convenient to do that, or not possible, we will make accommodations for folks. But if it's possible for you to go back, even though it may not be the most convenient thing, we do ask that you try to do that. Also, whoever gave it to you the first time is likely looking for you, and will hold your vaccine for a couple of weeks to make sure that you get your dose. So that's the other piece, is that they will be holding that dose because it's kind of got your name on it. So please, if you can, if you can't, we'll work with you.
Okay. Can someone still get COVID after the vaccination? Kemi. We'll ask the doctor this question.
So when you get the vaccination, it means that when you get exposed to it and you get infected, your body is able to fight it off much better. We have seen from the trials that some people do have some mild symptoms from it. It's really uncommon, actually. And it's remarkably effective at preventing any severe symptoms or death. So the short answer is yes, you can get some mild symptoms, but the really serious consequences, the vaccine is really tremendous at preventing those.
Okay, well then, Tricia asks, and this will be the final question. Once people get their first vaccine or have had both vaccines, do they still have to wear a mask? And if so, why? If it's so
That's not my
effective.
question, but I am curious of the answer.
He's muted.
You do need to wear the mask afterwards, and it's really for other people who haven't gotten the vaccine yet. So once you get the vaccine, you're good, right? But right now, our entire conversation is about not everybody has access to the vaccine. And what happens is, once again, if you get it and you happen to transmit it to somebody else, you'll probably be fine. But if they haven't gotten vaccinated, they won't be yet. So we're asking everybody to continue wearing your masks until enough people have gotten the vaccine that we can collectively stop wearing them. So yes to mask to help other people who haven't gotten vaccinated.
So while we've relaxed some of the restrictions in the county, and we're pretty close to where the state is on restrictions on activity and businesses, don't expect us to remove the masking requirement anytime soon. I don't think that will happen at the state level, and I don't think the feds will be recommending that we take off our masks. So in other words, we're not through this yet. Hang in there and continue to do the difficult things that you're doing to protect others. If we do that and these vaccines keep coming, we will absolutely get them distributed, and the summer and the fall and next winter, and the rest of our lives, hopefully, will be back to pretty much normal. Right, Dr. K, can I say that? Okay, good.
You can.
All right, well, thank you everybody for joining us. Please do go to aacounty.org and you can click through. You can find the health department. You can find really all the information that you need on COVID, as well as our weekly report. And hang in there. We'll get through this.